by now, you know that exercise is a pillar in managing your diabetes very well. We can also make sure we're doing this in a very safe and healthy way. I'm sure you've heard of some people, or maybe you've had the experience yourself of hypoglycemia. So that's low blood sugar. So when you have low blood sugar, things can get really scary really quick. Here are a few ideas that you can use to help manage that and, stay healthy and safe while exercising. We're going to start out with measuring your blood glucose. Now, hopefully you're already doing this, but you want that number somewhere in between 70 and 250. Those are kind of normal ranges for blood glucose. Some providers really recommend having a blood glucose around 100 or at least 100 before engaging in exercise, just to help prevent some of those low blood sugar moments. But you know your body best, and if you've got a continuous glucose monitor, you can set up little alerts. As long as you keep your phone close to you, your app can actually predict when you might have a low blood sugar event, and it'll help prompt you to have a snack. If you're below 100, you might just want to have a snack anyways, just to pump up that blood sugar before engaging in activity. Now, number two, lift before cardio. Now, this in the research has been shown to be an effective way to curb a hypoglycemic event. So it actually, by lifting weights before, and it can actually slow down that drop in blood sugar. Hydrate and snack. Just while you're exercising, make sure you're taking in lots of water, really throughout your day, but especially with exercise, and then have that snack just in case you start to feel those effects of low blood sugar, or your app starts to tell you to expect something in the next 15 minutes or so. Foot checks. Make sure there aren't any rocks, especially if you don't have any feeling on the bottom of your feet, or you have some altered sensation, you can't feel it quite as well. Check to make sure your feet are in good condition. There's nothing that you're stepping on or rubbing around in your shoes. And then afterwards, just make sure the skin and everything is intact. And then 5, exercise with a buddy. It's just way more fun. And also, if things go sideways, then you've got someone that can help you out in a pinch. And just remember that, this is a lifelong process. Take things nice and slow. There's really no need to rush with any of your progressions. So slow and steady is really the name of the game. And just remember, movement is medicine.